Amla grows in places that seem completely inhospitable. In the arid, sun-scorched valleys of India, where water is scarce and soil unforgiving, this hardy plant thrives by hoarding life-sustaining nutrients. Ayurvedic texts call it Amritfal, or the nectar fruit. For centuries, practitioners prescribed it as a supreme elixir, meant to extend lifespan and fortify the human body against decay. The fruit's density is nearly unmatched. A single amla contains roughly 20 times the vitamin C of a regular orange, making it the foundational ingredient in Chyawanprash, the dark paste consumed across India for daily immunity. This biological concentration translates into massive agricultural output. A single mature tree drops 100 kilograms of fruit annually, generating up to 500,000 rupees in annual profit per acre for farmers in dryland regions. This is a biologically potent powerhouse, a fruit evolved under extreme environmental stress to pack enormous chemical energy into a small package. Because amla is natural and widely marketed as a superfood, many modern consumers fall into a dangerous logic that doubling or tripling the intake will multiply the health benefits. But those drinking large daily glasses of amla juice for immunity are discovering a shocking paradox. They report sudden enamel erosion, severe hair damage, and internal dehydration. Amla possesses immense biological power, but without disciplined control, this ancient medicine functions as a destructive force within the human system. When consumed in moderate, deliberate doses, amla's chemical makeup provides substantial support to the body's internal systems. The dense payload of vitamin C and antioxidants floods the circulatory system, scrubbing oxidative stress from the blood and providing the chemical building blocks necessary for repairing bone tissue. In Ayurveda, this systemic reinforcement is viewed as a way to balance the three doshas, Vata, Pitta, and Kapha, bringing the body's primary biological energies into a state of equilibrium. These therapeutic effects have clinical applications, supporting the liver during jaundice, halting premature hair graying, and mitigating the clouding of cataracts. When the dosage is respected, amla acts as a systemic fortifier, providing the raw materials the body needs to reinforce its weakest physiological defenses. Problems begin when the body's processing threshold is crossed. There is a hard limit to the amount of raw acidity and plant fiber the human digestive tract can handle at once. This diagram shows the acidic burn effect. The extreme ascorbic acid in raw amla binds to calcium, dissolving the protective tooth enamel. Once reaching the stomach, it creates a massive spike in gastric acidity, causing chronic reflux and severe irritation of the esophageal lining. Then there is the fiber trap. While fiber is usually beneficial, amla is so dense that it acts like a biological sponge. Without massive water intake, it aggressively draws moisture out of the surrounding bodily tissues. This results in systemic shock. The digestive tract completely dries out, leading to acute dehydration and severe painful constipation. The risks extend to the blood as well. Excessive amla can cause a dangerous crash in glucose levels for diabetics and acts as a potent blood thinner, a critical risk factor for anyone heading into surgery. The exact biochemical mechanisms that allow amla to heal the body become weapons against the host when the body's processing capacity is overwhelmed. Successfully using amla requires the same precision as administering a high-potency medical concentrate. To master the dose, you must immediately rinse your mouth with water after consuming the juice. This simple step neutralizes the remaining ascorbic acid before it can bond with your enamel. You must also force heavy, deliberate hydration. This water is required to activate the fruit's dense fiber and prevent the internal desiccation that leads to systemic dehydration. There are absolute red lines. Pregnant women, diabetics, and surgical patients must consult a doctor before incorporating amla into their routine. True health mastery is found at the intersection of potency and restraint, understanding the exact biological limit where a superfood stops healing and begins